Welcome to Did You Know, a series of topical business updates brought to you by the Better Business for Good Business Advisors Alliance, a collaborative group of business specialists and advisors working together to ensure every small business has access to the knowledge and support they need to succeed in an ever-changing world. Today's episode is brought to you by Cameron Walker from Walker Safety Services and provides key information about forthcoming changes to Victorian Government occupational health and safety regulations.
Hello everyone, and thank you for joining me today for this information session on the proposed OHS amendment regulations for psychological health. I will be talking about what these planned amendments for the regulations mean and a bit of an overview of those amendments and what they mean for you and your business. So this morning's session will be recorded, and that is to provide the recording to you, so to help you with the information, to provide this information after this session. And it's really a guide to help you understand what all this means, and then also what you can do in your own business. But please do feel free to share this, the link to this recording to other people you know in your business network if you think it would benefit from them. So yes, this will be recorded. And I just want to introduce myself before we start. So my name is Cameron Walker from Walker Safety Services. This is my business, and we help other businesses with their occupational health and safety by providing ongoing support and advice, as well as helping set up and manage safety systems within businesses. And I've got 18 years in occupational health and safety in a range of industries and a range of workplaces, and been operating my business for the past 3 years. So today, we will look at the overview of the proposed changes to the regulations, and I'll talk about what those changes look like if they do come in, the time frame for when this is likely to come in, what this means for you and your business, and what you can do now, and also we'll have some time for questions. Now, if you do have questions outside of today, you can always contact me directly as well. So a bit of an overview of the proposed changes. So in response, in May 2021, the Victorian Government made a commitment to introduce regulations to address psychological health. Now, in response to that commitment from the Victorian Government, WorkSafe, they have prepared the Occupational Health and Safety Amendment regulations, which is the proposed regulations. And this is to include psychological health. So the proposed regulations will strengthen the occupational health and safety framework and will recognise that hazards that pose a risk to psychological health are no less harmful to workers' safety and well-being than physical hazards. So that's a really interesting point there. So traditionally with OHS and safety in workplaces, the legislation has been written around physical hazards. And the risk that those hazards pose to workers and employees. And so now what they're wanting to introduce is a framework increase the framework so it recognises that the hazards that pose a risk to psychological health, that they're not any less harmful. They don't harm anyone any less than a physical hazard. Actually, they're just as important as those physical hazards. And the proposed changes will also provide clearer guidance to employers on their obligations to better protect workers from mental injury. I'll talk a little bit more about mental injury and some stats later on. So in developing these proposed regulations, WorkSafe has also engaged directly with key stakeholders, including employee and employer representatives, industry experts, medical and allied health professionals, legal practitioners, and persons of lived experience, so people that have actually experienced mental injury. And this is to ensure all views and concerns are being considered and understood. Employers, employees, and other interested parties and members of the public were also invited to make submissions on the proposed regulations and the associated regulatory impact statement. So they did open this up for public comment, and that public comment is now closed, and all feedback provided during the public comment will be considered by WorkSafe and applied where appropriate. So just going back there, the public comment is now closed. I will go through the time frame a little bit later in this session, just so you understand the time frame involved and where it's currently at. A little bit about the current workplace mental injury status. So currently 16% of all new workers' compensation claims in Victoria are for mental injury. So 16% of all new claims. So every single claim that goes into the system, 16% of those in Victoria are for mental injury. And I'm not 100% sure on this, but I believe that they have, the WorkSafe or WorkCover have approximately about 100,000 active workers' comp claims in the system at the moment at any one time. And that's 100,000 people who are currently on a workers' comp claim. I'm not sure of the exact figure of the new workers' compensation claims, but currently 16% of all new workers' compensation claims in Victoria are for mental injury. And this is expected to double by 2030. So in another 8 years, they're expecting that to double to 32% of all new workers' compensation claims. Now, the average cost of a physical injury claim in Victoria is about $110,000. But the average cost of a mental injury claim is more than double that and is about $300,000. So more than double that of a physical injury claim. And mental injury claims result in a much slower and more complicated return to work. And on average, mental injury claims are more than double that of physical injury claims. So on that, the average mental injury claim is about 35 weeks. Now, currently, WorkSafe Victoria regulates risks to psychological health through the general duties in the OHS Act. So the OHS regulations do not include any specific provisions for psychological health. So currently, it's just under the general duties in the OHS Act, and it sits under identifying hazards and assessing those risks and controlling those risks, but under general OHS duties. So there's nothing specific about psychological health. And WorkSafe's current approach also relies on a non-statutory guidance, including a suite of non-statutory guidances published on WorkSafe's website. So there's compliance codes and other. So compliance codes, just so everyone knows, compliance codes are not a legally binding document. So if you follow the compliance code, it doesn't mean you will automatically comply with the OHS Act or the OHS regulations. It just means you are on the right track. So it's guidance material. The compliance codes are guidance material. They are designed to give you a guide on how to comply, but it doesn't give you automatic compliance. So you always need to refer to the sections of the Act and the sections, the regulations as well. So each particular regulation. And these guidance materials are to assist employers to meet their duties under the OHS Act for a range of risks to psychological health, including work-related violence, workplace bullying, work-related stress, work-related fatigue, family violence, and gendered violence, including sexual harassment. Now, with the guidance material, currently as part of developing the proposed OHS amendment regulations, WorkSafe are also developing a compliance code for psychological health. So that will help people and guide employers through how to comply with these proposed new regulations. And WorkSafe also has a Work Well program and toolkit. And I've put a link there, but you'll also receive this link and some other information in a follow-up email after this session. And this contains practical resources. It's also funded. So it's a free resource. It's funded by the government. And it also has networking opportunities to prevent mental injury and also to promote mentally healthy Victorian workplaces. I encourage everyone to have a look at that Work Well toolkit. It is a really valuable resource that is free from WorkSafe and helps to create a mentally healthy workplace. Now, the proposed regulations, so the key objectives of the proposed regulations are to promote the importance of psychological health and safety in the workplace, which I think is really important. And we really do encourage people to promote psychological health and safety in the workplace. It's also to elevate employers' awareness of psychological hazards to the same level as physical hazards. Now, remember, when we look at physical hazards, if we have a new worker, if we have a work cover claim, the cost is more than double from a physical injury to a mental injury, and the time spent off work for that worker is also more than double, and that's really important. So we do want to make sure that employers are more aware of these hazards and how to manage them. And it's to eliminate, always as far as is reasonably practicable, workplace psychological hazards. So really these regulations are about having a framework that allows workplaces, or has a duty for workplaces to identify these hazards, these psychological hazards, and then to assess the risks associated, and then to control those hazards. And where practical, we always want to eliminate those psychological hazards. And if we can't eliminate them, we can reduce them. And it's also to better protect Victorian workers' psychological health and safety against risks arising out of workplace psychological hazards. And to achieve this, the proposed regulations seek to implement the following changes. So really, they want to implement to clarify employers' requirements to identify psychological hazards in the workplace, to clarify employers' requirements to control the risks to health and safety associated with psychological hazards, and to introduce requirements to maintain written prevention plans for certain psychological hazards. So this will create some extra work for businesses. And I will talk a little bit more about what a prevention plan is and for what certain psychological hazards a prevention plan is required. But there will be additional work required from most businesses in identifying those hazards and writing a prevention plan as well. And it will also, these proposed regulations will also introduce a reporting scheme for applicable employers. So employers that have 50 or more employees at any time in the reporting period, to report directly to WorkSafe written reporting for certain psychological hazards. And again, I will go through what those certain psychological hazards are shortly. So there are a few new things that will be required of businesses and employers. So I will go through the details of that soon, but this is important to know because there are additional things that are required to comply with these new regulations. Now, here's a summary of proposed changes to the OHS regulations. So it is proposing to insert a number of new definitions in the OHS regulations to support employers' understanding of psychological hazards. And these definitions will include bullying, high job demands, psychological response, reportable psychological complaint, sexual harassment, and work design. Now, these definitions will be outlined in the regulations. I believe it's in Regulation 5 under definitions, and some of those are available, and some of them, the rest of them, will be available once the new regulations come into act and when they commence. But if you would like further information or clarification on what these definitions will be or are likely to be, please contact me directly. Now, the proposed changes will introduce a new Chapter 5A in the regulations. So it will insert a new chapter into the regulations, the OHS regulations, which deals with psychological health and risks associated with psychosocial hazards. Really important to understand what psychosocial hazards are. So the definition for psychosocial hazard is factors in the design or the management of work that increase the risk of work-related stress and can lead to psychological or physical harm. Examples of psychosocial hazards might include poor supervisor support or high job demands. There are other things in there as well, but that's an example of some psychosocial hazards that might occur in the workplace. So poor supervisor support, not supporting your workers enough, or high job demands. A really interesting point there that there's some HR people that are on this session, as well as that I deal with regularly, and they work really closely with their clients on providing really accurate and detailed position descriptions. So for a business owner and for an employer, if you have position descriptions in your business for your workers, it is super important that you understand and your managers understand what those position descriptions detail. So what you're asking of your workers, because if your position description is asking for high job demands, more than what the worker is capable of, then that can be a psychosocial hazard, and that can increase workplace stress. So these will be things that you will need to identify and also assess and manage in the new regulations. Again, if anyone needs help with this, then I'm more than happy to help. So psychosocial hazard means any factor or factors in the work design, the system of work, the management of work, the carrying out of the work, personal or work-related interactions that may arise in the working environment and may cause an employee to experience one or more negative psychosocial response that creates a risk to their health and safety. So these are really important to understand. So we're talking about work design and systems of work. So work design is the design of the work area and the design of the work that an employee is doing. So it doesn't necessarily have to mean the work design of someone in a factory or on a construction site. It can be of someone who's working at home or working remotely. It's the work design. So what work are they doing? How has that work been designed? And are there any psychosocial hazards? And the system of work, so how the work is done. The management of work, so the supervision, and also the carrying out of that work, and any personal or work-related interactions. So Chapter 5 will introduce new duties for employers, that's supposed to be, to identify psychological hazards. So one of these things that's coming in is that as an employer, you will need to identify psychological hazards. Then you will need to control the risk. So generally, the process is that when you identify a hazard, you assess that hazard, you assess the risks associated with that hazard, so you can understand the level of risk, and then you develop and implement control measures for those risks. And then in these new duties, that employers will be required to review these risk control measures and revise them if needed to help manage those risks. And also introduced here in these new duties will be a duty to prepare prevention plans for certain psychological hazards, which include, now I went through this before, but these psychological hazards include aggression or violence, bullying, exposure to traumatic content or events, high job demands, and sexual harassment. Okay, so for psychological hazards that, such as aggression or violence, bullying, exposure to traumatic content or events, high job demands, and sexual harassment, employers will be required to prepare prevention plans and implement those prevention plans for these hazards. So that's a new requirement that's going to come in. So the easiest way that we will be doing this for our clients, with our clients and anyone else who wants assistance with this, is we will be helping to identify these hazards in workplaces. And then we will be doing what we call a risk assessment. And the easiest way to understand these hazards and understand the risks associated with these hazards is do a risk assessment. So then once we've done a risk assessment, we can understand the level of risk, and we can also understand what control measures might need to be developed and implemented to either eliminate or reduce and manage the risks associated with these hazards. So that's a really important one, and that's a new requirement that will be coming in if these proposed regulations come in. So Chapter 5 will also introduce a new duty to report, so a new reporting requirement. So any employee that has 50 or more, any employer that has 50 or more employees will be required to provide a written report to WorkSafe within 30 days of the end of each reporting period per year. And there are 2 reporting periods. So basically it will be that at the end of the calendar year, so at the end of December and the end of June in the financial year, those are the 2 reporting periods. So they're a 6-month period, and employers with over 50 or more employees anytime in those reporting periods. So if you go up to 50 or more employees once, and then you drop down under 50 employees, you'll have this reporting requirement. And it's on the reportable psychological complaint. So it's on these particular areas. Now, a reportable psychological complaint means a complaint involving any of the following psychological hazards: aggression or violence, bullying, and sexual harassment. So the reporting requirements will be that if you have a psychological complaint against any of the following, involving any of the following psychological hazards, such as aggression or violence, bullying, and sexual harassment, you will need to provide a written report to WorkSafe Victoria. And I'm pretty confident, because I've read a lot of their information, they are going to provide an approved method of providing a written report. So they will provide either a template, or it will be, here's the criteria on what you need to include, and that will be provided by WorkSafe to help employers understand what the reporting requirement is and what needs to be provided in that written report. But that is another duty that's being introduced with these proposed regulations. Now, the proposed regulations and associated regulatory impact statement, these were released for public comment from the 17th of February to the 31st of March 2022. So the public comment is now closed, and WorkSafe will review and consider all submissions received and amend the proposed regulations where appropriate. And potential changes may also be discussed directly with key stakeholders before finalising these regulations. So they did receive 79 submissions through the public comment section. So it takes some time to go through those public comments and review them as well, and then introduce or add any potential changes that might be required. Now, the new regulations were originally planned to commence on 1st of July 2022. Obviously, that's passed. So now they are likely to commence later in 2022 or at the end of 2022, depends on when they finalise the proposed regulations based on the public comment and when it gets passed through Parliament. Now, I think it will get passed through Parliament. I think it will get passed through, and once it does, it will come into effect. Often once it's passed through Parliament, they'll just finalise the regulations, and there will be a set date for when it starts. Now, the new duties under Part 5A1 and Part 5A2 in the regulations, so these new duties that I've talked about before, they will apply immediately upon commencement. So the moment these new regulations, the amended regulations, commence, these new duties will immediately apply. Okay, so that's really important, because once they apply, they're a legal duty. So you have a duty to do these things, and it's the things I talked about before. But the commencement of Part 5A3, which is the penalties for failure to comply with certain duties under the proposed regulations, will be delayed until 1st of September 2023. So any penalties for failure to comply with these new regulations, or these new duties of the regulations, will be delayed until 1st of September 2023. What that really means is that even though those duties will apply immediately, we've got some time to comply with these new duties. Okay, so there won't be any penalties given out for breaches or failures to comply with these duties until the 1st of September 2023. So we've got a bit of time to prepare and get businesses ready. So enforcement of the new regulations will not start until 1st of September 2023. That's really important. So what do the proposed amendments mean for you and your business? So it does bring in new duties to identify psychological hazards. Okay, so there are new duties in these regulations if they come into effect. It brings in new duties that as a business, as an employer, you will have new duties to comply with. If you are identifying physical hazards and controlling the risks associated with those physical hazards, and if you have in that hazard and risk management system within your business, if you include psychological hazards, then you will most likely be complying with the new regulations when they come in. If you're unsure whether you do have this included in your business, if you're unsure whether you will comply or what you might need to do specifically for your business as an employer, please reach out, because I'm happy to have a conversation about what that might mean and whether you are going to comply and what you might need to introduce to your business. And it will mean that you will need to assess the risks associated with the hazards and then control those risks. Now, once those risks are controlled, it's not a stop there process. It's like any hazard identification and risk management process. It's a continuous cycle. It's a continuous improvement. So after we've controlled the risk, we also need to review those control measures, and we need to make sure those control measures are effective and make sure they haven't introduced any new either physical or psychological hazards. And you will also need to develop and implement prevention plans for aggression or violence, bullying, exposure to traumatic content or events, high job demands, and sexual harassment. So if these hazards occur or are likely to occur in your business, then you will need to identify these hazards and you'll need to implement prevention plans, written prevention plans. And those prevention plans they're very similar to a risk assessment. They're designed to identify the hazard, understand the risk associated with the hazard, and what control measures you're putting in place as an employer to either eliminate or reduce the risk. So that will be something that if you're aware of these hazards already, or you think that they might be something that your employees face, then it's worth having a conversation and worth looking at how that prevention plan will work for your business. And the sooner you can do that, the better. And again, employers of 50 or more employees will have to provide a written report to WorkSafe twice a year for any reportable psychosocial complaint. A reportable psychosocial complaint means a complaint involving any of the following psychological hazards, and that is aggression or violence, bullying, or sexual harassment. Okay, so if you're a business of 50 more employees at any time in the reporting period, and you have any psychological complaints about aggression or violence, bullying, or sexual harassment, then you will need to provide a written report to WorkSafe Victoria within 30 days of the end of that reporting period. Now, I spoke to a new client the other day, and they had a situation, NDIS provider, and they have a support worker or care worker working directly with one person, their client. So this person is getting one-on-one support care. And the worker, so the employee for the NDIS provider, was driving the car, and the client was sitting in the front passenger seat. And while they're driving, that client started attacking the employee driving, by hitting and scratching that person. So the employee pulled over, and managed to get out of the car. Once they pulled over, this attacking continued and got worse. The worker managed to get out of the vehicle and call the police. The police and ambulance arrived. The police intervened and separated the two, and they were both taken to separate hospitals. And what comes out of that is WorkSafe investigation and some improvements required. Now, this NDIS provider, this business, they have really complex NDIS policies and procedures, which is required from NDIS, but they didn't have OHS documentation, policies, procedures detailing how they would manage these hazards and risks that this worker faced at this particular day. So WorkSafe have then said, you need to develop and provide these to us so we're satisfied with the way you're managing these risks. A couple of things that come to mind for me, some really easy ways to identify control measures is, should that client be sitting in the front passenger seat where they're closer and it's easier for them to attack the worker? I don't think so, probably not. Maybe they should be sitting in the back. Should they be sitting directly behind the driver? No, because that becomes a really, really high risk of the worker being attacked and strangled or choked. So you could easily develop some policies and procedures around this. And one aspect of that would be that the client has to sit in the back seat diagonally from the driver, so there's clear vision all the time. In some cases, this is not always going to be practical. In some cases, you might be able to install protective screens in the vehicle. You would also detail in your policies procedures that workers are to have their car keys on them at all times, so they can easily escape from a house or a building with a client, wherever that might be. And you would also detail in the policies and procedures how that worker can raise the alarm with someone in the organisation if there is a major incident or if they're being attacked. And some methods of raising that alarm are maybe they have an alarm, personal alarm that they carry. I would avoid having them on a lanyard, again, because the client could easily choke them. If they are a lanyard, have a quick release. So when they pull it, it snaps off and it doesn't hurt the person. But a personal alarm is a great way to alert and raise the alarm that something's happening. So there's multiple ways we can introduce control measures to manage this risk and prevent that kind of thing happening again. Currently, those duties sort of sit under the physical hazard part of the duties. In the new proposed OHS regulations, these will become specific duties. So you will need to identify this stuff and you will need to have things in place to manage it. If you don't, then you are facing breaches of those regulations, of those duties, and potential fines from WorkSafe Victoria as well. So we know from WorkSafe that a mental injury workers' compensation claim can be accepted in Victoria, and for that claim to be accepted in Victoria, there only needs to be one work-related contributing factor, okay? So in this case, it doesn't matter how many factors or what the factors outside of work are. If there's one work-related contributing factor, then that claim will be accepted, or is most likely going to be accepted. In other states like New South Wales, they require 50% of the contributing factors to be work-related. In Victoria, it's one contributing factor, work-related contributing factor. So that could be that person is exposed to work-related stress, or it could be that and that can be created from high job demand, poor job role clarity, poorly managed, and a number of other things. Or it could be that they're exposed to bullying or harassment or sexual harassment or gender-related harassment or aggression or violence. So the example there would be that if you're a business that operates in hospitality or retail, we saw a lot of this during COVID, then if your workers are exposed to customers that get aggressive and have aggressive behaviour towards your workers, then that's a contributing factor. And if they suffer from a mental injury, and that contributing factor is work-related, then that's all you need for a workers' comp claim to be accepted. And earlier in 2021, provisional payments were also introduced. So workers who have suffered a work-related mental injury are entitled to provisional payments for the first 13 weeks, even if their claim is not accepted. So what that means is that if a claim is submitted, so workers' compensation claim is submitted, and that is for a mental injury, there's a process for reviewing that claim and assessing that claim, and that is done by the agents. Now, that worker is entitled to payments for the first 13 weeks while that claim is being assessed. And even if that claim is not accepted, that person will receive and is entitled to receive 13 weeks of payments. So if they're accepted, then they go onto the standard work cover program, 13 weeks at 95% of their pre-injury wage, and then it goes to, I think it's 85%. But if if their claim is not accepted and it's not successful, they will still receive those payments for 13 weeks regardless. And in Victoria, for a mental injury workers' compensation claim to be accepted, there only needs to be one work-related contributing factor for the claim to be accepted. Again, that's that one contributing factor. And some penalties. So it is important to know what these penalties are. It doesn't mean that you will face these penalties, but it's important to understand what this could mean for your business. So the penalties for breaches of the new duties under the proposed regulations. So they currently are sitting at up to $11,095 for a natural person. So that doesn't mean an individual person in a business. It means that it's for a natural person. So it could be an organisation classed as a natural person, and there are definitions around that. And that is currently sitting at up to 60 penalty points. So the penalty points have just gone up, and those penalty points are increased every year. And when there's a charge against a breach of the Act or regulations, the court will decide what that penalty is based on those penalty points, penalty units, and up to 60 penalty point units. So it could be less. And for a body corporate, so for an organisation, that fine, that penalty could be up to $55,476, which is up to 300 penalty points. So I'm pretty confident there's no business out there that wants to be fined any of those amounts, because it's a big hit to your business. So the best way to avoid that is to understand these new proposed regulations and implement the right things in your business to manage those the psychological hazards and to comply with those duties under the proposed regulations. The best thing you can do right now is review and update your current OHS policies and procedures and systems. So if you haven't reviewed and updated your current policies, procedures and systems in the last 12 months, now's the time to do it. And when you do that review and when you do that update, make sure you include psychological hazards in your policies and procedures. So really what you need to do is go through a hazard identification and risk assessment process to identify those psychological hazards and psychosocial hazards in your business. And once you've done that, you can develop and implement prevention plans for psychological hazards that were listed earlier. And then you can start to treat psychological hazards the same as physical hazards. So you want to start doing that now. You really want to start looking at psychological hazards exactly the same as physical hazards. This is the way of the future. Psychological hazards and psychological health and safety is a big part of occupational health and safety in this current time. And mental injury is a big thing. 16% of new claims. That'll double by 2030. What we will be doing with our clients and anyone else who needs assistance is we will be doing psychological hazard identification and risk assessment for businesses. So we'll have a look at what those psychological hazards are in your business, and we'll do a risk assessment to understand the risks and the level of risk, and then help you to develop control measures to eliminate or reduce those risks. So if you are unsure or you don't know where to start or you don't know what to do, seek professional advice and support if needed. Not just us, anyone who is a professional OHS person, they can help you out. But please, if you are unsure, please seek professional advice and support. And if you are unsure, ask questions. Reach out to myself or my team. I'll provide my details shortly, but please do reach out and ask questions. I want to help people. I want to make sure that you have access to help with this. So some questions that came up recently, and I want to answer these questions now, but if you do have further questions, please do feel free to reach out via email or phone, and I will help you with answers to those questions as much as I can. So one question that came up is, do you think there will be an increase in workers' compensation claims due to these changes? Well, the answer to that question is I don't think there will be. There's already, in the next 8 years, there's going to be an increase in workers' compensation claims anyway, because we've seen that by 2030, it's going to double from 16% of new claims to 32% of new claims are mental injury claims. I don't think this will increase the claims. This has been happening for a while. This has been increasing for a while. I don't think we'll see an increase in claims. I just think we'll see a shift in the way businesses understand health and safety and psychological hazards. And by bringing in these new regulations, it's like any occupational health and safety. It's like any safety in any business. If it's done really, really well, if safety is managed really, really well, you will see a return on investment. Okay, so we will see that reduction in claims, and that's the whole point of bringing in these changes. But when safety is managed poorly, then you don't see that reduction in claims. And in your own business, you don't see a return on investment, and you don't see improvements in health and safety and psychological risks, hazards and risks. You see that either staying the same or getting worse. So I think this strengthens the way health and safety is managed in the future. There's a couple of HR professionals and consultants on the call today, in this session today, and I work with quite a few on a regular basis. And one question that was asked was, how will this work with HR and performance management of employees? And again, a great question. Now, what I encourage is that if you're looking at HR management and you're looking at HR in your business, what I think is really important is not just having the right job description or role description in your business. It's also understanding as an employer, as a manager, what that job description is, what you're asking of your employees. Because if you're asking too much, then you're potentially introducing and exposing your employees to psychological hazards. When it comes to performance management, I think the two can work in. We've just got to understand how that works. We've got to separate poor employee performance versus, and we've got to separate that from psychological hazards and work-related factors. So it's really important in your business to understand what those work-related factors are and what those psychological hazards are, and separate that bad performance or poor performance from those factors. Because if you try and manage an employee based on those hazards or those work-related factors, then that's when you're potentially breaching the sections of the new regulations, the proposed regulations. So we want to understand that we're managing poor performance and making sure that any work-related factors are not introduced. I think it's going to throw some challenges for HR people, and it's going to throw some challenges around performance management. But the best thing that you can do is work together. So HR and safety, side by side, let's work together to help understand this. If you've got HR in your business, if you've got someone working with you with HR, always make sure you have someone in safety as well. If that HR business is able to provide you with OHS support, great. If not, seek external support. Really important, because you don't want to just have focus on HR. Even more now with these proposed regulations, you want to have a really good focus on HR as well as safety, as well as OHS, as well as psychological health and safety. And how do we know what psychological hazards are in our business, and how can we identify these? So I've covered off a lot about what psychological hazards are in business, in workplaces. I think it's not a one size fits all. It's never every business is the same, so all the hazards and risks are the same. You can have a set of an understanding of what those hazards are going to be like, but I think it comes down to doing a risk assessment. And I would be doing, we suggest that you do one of two ways. Is you either incorporate psychological hazards into your risk assessment that you're doing for physical hazards. So incorporate the two, but highlight that they're a psychological hazard. So highlight that so you can assess that differently, assess that as a psychological hazard. And when these regulations come in, you can then assess them complying with those regulations. Or you can do two separate risk assessments, or you can do multiple risk assessments, but you can do one that focuses on risk assessment of physical hazards, and a separate risk assessment for psychological hazards. Either way, it's going to do the same thing. Sometimes separating the two makes it easier to read and understand and to manage. So it depends on what you want to do. Some of the bigger organizations we work with, we separate and do two separate risk assessments. We look at psychological hazards on a completely different risk assessment, just so it easily separates the two. When we do it as one, we usually do a section of a psychological hazard at the top and then a section of physical hazards at the bottom. And thank you again for attending this information session. You will be provided with a link to the recording so that you can watch this again and get more information out of it. And myself and the team at Walker Safety Services are here to help you. So if you do have any questions specific to your business, please feel free to contact us directly. There's my website. You can email at info@walkersafetyservices.com. My contact number is there, so feel free to text me or give me a call if you have questions that relate to your business. And if you'd like to book in a meeting with me, there's a QR code there. So you can scan that QR code. It takes you directly to my calendar link where you can book in a 15-minute phone call with me. And if we need more than 15 minutes, then we can arrange that as well. We have ongoing regular safety memberships that we can help you with that give you unlimited ongoing support and advice. And that is a really great service we offer, especially with these proposed regulations coming in. So thank you again for coming. I hope you've gained some valuable information out of today's session. And if you do need any further assistance or advice, please feel free to reach out to myself or my team. Thanks. Have a great day.